I'm a research scientist, molecular biologist by training, and I'm interested in the fight of vector-borne diseases.
I wear two hats. One as a scientist, a microbiologist, and on the other hand, I'm also a youth champion.
I am a doctor. I work in a pediatric hospital in the ICU.
I'm a medical doctor and a public health practitioner based in Nairobi.
I work at GSK. I'm the vaccines medical manager covering Kenya and East Africa.
I am a medical doctor, a public health specialist, youth advocate, and a scientist. It's important to always say I'm a scientist. Sometimes it's very hard as women to say and to own the word scientist, but yes, a scientist.
My brother passed on of this disease. My mom was frustrated to ensure that this boy was in hospital, and my dad, but by the time he got to hospital, they realized that he had what we call as blood stage malaria. This took him down. They tried to transfuse, but later he passed on. This really affected my family. The fact that I don't have my brother till now, that really affected me a lot.
About 96% of most of the malarial cases globally are from the African region, particularly the sub-Saharan region.
Statistically, we know that every 6th second, like 1 minute, a child dies of this disease.
During my medical training, particularly in the pediatric rotation, I think I witnessed a lot of deaths among children under 5 from malaria.
When you look at how malaria affects a child, it affects the mother, who often is the caregiver in the society that we live in.
For me, as a mother of a child, a daughter under 5, I think it becomes personal that we do need to contribute to this fight against malaria.
My role in the fight against malaria is, first of all, to ensure that I practice what I preach at home, sleeping under a mosquito net, draining stagnant water. I also think it's my role to educate other young mothers like me, because we tend to speak to each other about the dangers of malaria, the signs of malaria, and how to prevent it.
These women, since they are the implementers at community levels, they need to be involved at community levels, even at decision-making tables. We need to bring most of these women on board.
The new innovation that I am excited about, the fight against malaria, are the vaccines.
I think because it's just been years and years and years and years of work that had gone into it, and I think at some point no one expected that this would be a possibility.
And so I think it was also a personal moment of pride, being that, hey, I worked on that study. I mean, that's some of my work that's contributing to this policy recommendation. So I think that was quite exciting.
So what we need to do is to channel more resources in the fight against malaria.
We have songs that are telling people go for HIV testing. Why can't we have songs that are talking about, malaria and the rest? So I think the youth have such a big role right now to play, and they have so many ways of doing it.
The biggest resource we have is the internet, especially as young people. Coming across information is as simple as Googling, how do I prevent malaria?
We shouldn't rest till we bring this disease to an end.
So as much as we have the existing tools and resources, I think we need more investment towards them.
The Global Fund funds over 50% of malaria interventions. The strategic plan is to have 1 mosquito net per 2 people in a household.
How do we come up with tools that can counter insecticide resistance, tools that can counter drug resistance, and also tools that can boost immunity?
2022 is a crucial year in terms of Global Fund, because we're trying to come out of a 2-year pandemic. We need these funds more than ever.
If we were to eradicate malaria, I think at the community level it would be excellent, because we would have more children attending school. As we know, very many children are not able to go to school because they have malarial infections.
Girls will have more time to be in school. Girls will have more time to be empowered. We're going to have more time to research on other life-threatening diseases. We're going to burden less our healthcare system.
This is going to impact the economy positively, because then if we end malaria, then the focus will be towards other things.
We can end malaria and create a safer world for everyone.
This International Women's Day, I choose to break the bias and fight for what counts.
Invest in the Global Fund and fight for what counts.
Be the generation to end malaria for good.
Zero malaria starts with me.